697 COVID cases, 4,381 new cases reported since yesterday, 3,464 people in the hospital, and sadly 15,811 people who have died. Most of these deaths now are preventable with life-giving vaccines. If you hadn't gotten a shot and you're not yet sick, it's not too late. And if you have had COVID but are now negative, a vaccine still gives you great protection against this disease. This week, North Carolina marks an encouraging milestone in the fight against this pandemic. 90% of North Carolinians aged 65 and older have now received at least one dose of the vaccine. 87% of them are fully vaccinated. I appreciate the hard work of the North Carolina Department of Health and Human Services, as well as local health departments, doctors' offices, clinics, faith leaders, hospitals, pharmacies, the National Guard, long-term care facilities, and more who've helped us reach this milestone. As we continue battling this disease, it's good to pause and celebrate achievements like this. Every vaccine given is a potential life saved. But there's more work to do, especially making sure that younger people get shots. Less than half of those ages 12 to 24 have had one dose, and case rates right now are the highest in this age group. We remain laser focused on helping more North Carolinians make that decision to get vaccinated. This week, Secretary Mandy Cohen and I are sharing a letter with faith leaders asking them to encourage their congregations to get vaccinated and to help us combat misinformation about vaccines and treatment. Some houses of worship have also served as vaccination sites, and I hope more will do so. Faith leaders from all religious backgrounds can be trusted figures in their communities. Their word can go a long way in encouraging people in their congregations to talk with doctors and understand that these vaccines are safe and effective. And the North Carolina Department of Health and Human Services Healthier Together team can even help these houses of worship sponsor their own vaccine clinics. We're so grateful for all of the faith leaders who are ministering to their congregations by helping to save lives and getting more people vaccinated. And we'll continue to support them however we can. Under my executive order, North Carolina cabinet agencies are working to require employees to verify that they've been vaccinated or either collect their weekly COVID test results. It's positive that many state agencies are reporting high percentages of vaccinated employees, but here again, there's more work to do. We continue to educate employees who have questions about the vaccine or who need help finding a place to get their shots. And I encourage more businesses to follow this example by implementing their own vaccine requirements. It'll make North Carolinians and our economy healthier and help keep your business thriving. Right now, I'd like to ask Dr. Mandy Cohen, the Secretary of the North Carolina Department of Health and Human Services, to provide an update on North Carolina's COVID-19 trends. Dr. Cohen.
Great. Thank you, Governor. I want to echo the Governor's gratitude to all our faith leaders, and I particularly want to thank the more than 5.5 million North Carolinians who've already gotten their first shot so that we can keep people well, save lives, and get closer to ending this pandemic. Okay, with that, let's dive into the data. Our first graph looks at people who come to the emergency department with COVID-like symptoms. It's our earliest detection mechanism. And you can see when looking at the yellow line that it rose dramatically through July and August. However, if you look at that far right, there is positive news. This line has started to go down for the first time in a few months. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case in March of 2020. The peak in the middle of the graph is back in January of this year before vaccines were widely available. And now look to the right side of the graph and notice how steep that yellow line was in August and much of September. This summer, we experienced the fastest rise in cases since the pandemic started. So let's zoom in and look at just the last few weeks in terms of cases. On this graph, we're looking at cases from the end of July through today, and you can see that our cases remain high. We're still averaging around 6,000 new COVID cases each day. And while the numbers are still too high, they have been relatively level and are at least not increasing further. Our case rates remain highest for children 17 and younger. For the week ending September 18th, children made up almost a third of the state's new COVID cases. And that's a trend we have seen for the past 3 weeks. On our next slide, we look at the percent of tests that are positive. This graph goes back to late July, and looking at the yellow line, our percent of positive tests is hovering around 10%. Slightly better, but still well above our 5% goal. Our next graph, we look at day-over-day hospitalizations. This graph also starts back in late July, and after weeks of increase, looking at that yellow line, you can see that this trend is leveling. Unfortunately, people are still getting very sick. For close to a month now, we have been near or above 900 North Carolinians requiring intensive care unit beds. And a third of all new COVID hospital admissions in the past week have been in people under the age of 49. Our hospitals are strained, and in other states, we've seen that care is not readily available for people experiencing non-COVID, life-threatening health crises. We don't want that to be the experience here in North Carolina. This next slide looks at what's happening at the local level. It's a map from the CDC that shows the level of viral transmission. And as you can see from the map, all North Carolina counties are red with high levels of viral transmission. That means everyone in North Carolina should be following the CDC guidance and wearing a mask indoors in public spaces until more people are vaccinated and viral transmission decreases to at least moderate or low levels. All schools should require masks to keep everyone in school for in-person learning. Okay, now let's turn and look at our vaccinations. Today, 61% of North Carolinians ages 12 and older are fully vaccinated, 63% of those 18 and older are fully vaccinated, and 87% of those 65 and older are fully vaccinated. And as the governor said, 90% of those 65 and older have had at least one shot. I want to thank the millions of North Carolinians who've already been vaccinated and are protecting themselves, their communities, and our children who cannot yet get vaccinated. Our last data slide today shows the percent of the population fully vaccinated by age group. And you can see that only 38% of children ages 12 to 17 are fully vaccinated, and only 42% of young people ages 18 to 24, are fully vaccinated. I encourage our teens to visit teenvaxfacts.com to get the information and resources they need to educate themselves about COVID-19 vaccines. Before I wrap up, I want to spend a moment talking about the decision to get vaccinated. For some people, the decision to get vaccinated was very easy. For others, the decision to get vaccinated is more complicated, and folks still have questions. And we know there is a lot of misinformation out there. Please talk with a doctor, a nurse, or other medical professional. Go to reliable online health resources like the Centers for Disease Control or yourspotyourshot.nc.gov, or participate in a Department of Health and Human Services sponsored online event to be sure you're getting reliable information. You can see our past online events on our Facebook page. I want you to get the facts to help you make the decision to get vaccinated. The COVID-19 virus is more contagious than ever, and we are seeing it attack the unvaccinated and make them very sick at an alarming rate. My heart breaks for each life lost, for each person living with ongoing symptoms of COVID even after they recover, and for the families, friends, and communities picking up the pieces. This doesn't need to happen. More than 181 million Americans have been safely vaccinated. Vaccines are safe and effective and saving lives. It is COVID that is making so many people critically ill, leaving many with long-lasting symptoms and sadly killing more than 15,000 North Carolinians. If you've already gotten your shot, thank you. If you haven't yet, I hope you will choose